Right. So for example,
wait, but suction abortion in the first trimester is still dismembering the baby.
If they're doing suction abortion, I'm talking about, say, okay, she's 8 weeks along.
Right.
She has this diagnosis. She's got to go forward with her treatment.
Yeah.
Are you saying that taking the misoprostol mifepristone is going to, that's
the medical pill abortion, which is still an abortion. You're cutting off the progesterone for that baby.
But this
and
isn't dismembering it sounds really horrible how you say it.
That was Lynn Wolf and Dr. Monique Ruberu, two passionate medical professionals.
It's not the mother's intention to kill the child. It's a secondary effect from the chemotherapy that we're using to try and save the mother's life.
You would rather, continue the pregnancy, subject this unborn child to the chemotherapy as well until they die?
In the last pro-life versus pro-choice debate I hosted, we covered the ethics of abortion. In this episode, I brought on two medical professionals to evaluate the medical necessity or lack of for abortion. Is the removal of ectopic pregnancy an abortion?
I mean, that depends on how you're looking at it. Strict medical terms, yes.
Under the law, is that considered abortion? When Roe v. Wade was overturned, people are thinking women can no longer get treatment for ectopic pregnancy.
There was so much misconception. They would say things like, women are going to die of ectopics because you can't remove an ectopic pregnancy. That has never been the case.
Dr. Monique Ruberu is a pro-life board-certified OBGYN who owns and operates a private holistic GYN and fertility practice. She's a convinced Catholic, mother of 5 with 2 in heaven, and a passionate pro-life advocate and public speaker.
Babies with Down syndrome, I believe, are the greatest gift to this planet. I come at abortion from an equal rights sort of perspective. 90% of Down syndrome babies are aborted.
Lynn is a pro-choice mother of 3 who is a dual certified nurse midwife and psychiatric mental health nurse practitioner. Before completing her master's and postmasters education, Lynn was a labor and delivery nurse at a large teaching hospital.
As providers, what we owe our patients is to provide them with options. I'm a woman, it's my body, it's my right to choose whether or not I want to continue with the pregnancy.
I have had so many women come to me in their 60s that had abortions in their teens, that have recurrent nightmares. The sound of a dentist's office drill takes them back, and then they feel horrible because it's similar to the sound of the suction machine. She could escape all of that trauma, and she would also have that sense that I never gave up on my child.
But just not everybody can do that. Everybody processes and grieves in their own way. For one person, that is a beautiful way to grieve, knowing they're going to lose their child. For another person, that's more painful.
We get down to the most important questions that help us as the listeners to understand exactly what an abortion is and what it isn't. If abortion bans will prevent women from getting the care that they need, and the dialogue around tackling a challenging circumstance and diagnosis. Your original stance is that, yes, it is sometimes medically necessary. So when is it medically necessary?
So I can never say yes exactly.
Now you're explaining all these handfuls of situations that are abortions that are medically necessary. But your argument is that those are not abortions, even under the medical consensus?
Correct, because...
Welcome to the Ellen Fisher Podcast. Before we begin, I want to share something with you. In any debate that I organize to the best of my ability, I'm always looking to lock in the best advocate that I can for each side of the discussion. Often that means prominent social media activists because how they convey their position clearly resonates with a lot of people. But the truth is, I'm not able to get on anyone that I please every single time. And not everyone wants to be part of discussions like this where their ideas might be challenged. And so I'm grateful for every person who has graciously come onto my podcast for conversations like these. For this particular episode, I was connected with Dr. Monique Ruberu, who was interested in having a discussion with another medical professional on if abortion is ever medically necessary. So I began to reach out to the most prominent pro-choice OBGYNs and midwives. Most of them ignored my many attempted emails, and one of them even flat out said it was unethical to even have this discussion, that other people's opinions who are not her own don't matter, and that the discussion itself could be harmful. So I was at a loss of not being able to get any pro-choice OBGYN willing to debate Monique and about to give up on organizing this debate when practically last minute a friend of mine realized that she knows a pro-choice midwife, and that person was Lynn Wolf, who said she would be happy to come on to my show. So Monique and Lynn, thank you so much for making this conversation possible. A much needed episode in a time with so much confusion about what is what. I am baffled by people that think honest conversations like these are harmful. Trying to understand the way the other side thinks, advocating for two sides of passionate and polarizing topics, and attempting to clear the mud can only bring good things. In a world that profits from us being disconnected from ourselves and each other, give people the grace to surprise you. Thank you both for being here. I am super
interested in how this conversation is going to play out. I have so many questions and so many things I want to hear from you both. In the last pro-life versus pro-choice episode that I hosted and moderated, which anybody listening can go back to my season 1 and watch, we discovered the ethics of abortion. And for this episode, I'm bringing on 2 medical professionals evaluating the medical necessity or lack of medical necessity for abortion. So I'm really curious to hear, do you agree or disagree that the vast majority of these cases we'll be covering would be for women given difficult diagnoses with pregnancies that are wanted? Why don't you go first?
Potentially, yes. I mean, I think, in a lot of these situations, by the time they get to a point where they realize there's a difficult diagnosis or there's something that isn't quite going right, they've kind of gotten to the point where they maybe want the pregnancy, but not necessarily all of the time.
Mm-hmm. What about you?
I think when women are given a diagnosis, which is very difficult, and they're provided with the option of an abortion, oftentimes the person who is offering that to them plays a huge role in how they present the current situation, the hope within that situation, the scariness of the situation. And so something that may seem like life-breaking for one may not seem like that big of a deal for another, just based on how it's presented. So yeah, I feel like a lot of women who are choosing this or being presented with this, it may be a situation where it's something lethal or it's something that is considered devastating, but it may just be a situation where it's mildly inconvenient or scary.
Mm-hmm. Okay. And to start, let's correctly define abortion and see if you agree on that definition. So what is an abortion exactly? Why don't you go first?
So abortion is an intentional ending of life of a preborn human being.
I only slightly disagree in that because abortion, I mean, there's therapeutic abortion and spontaneous abortion. So any loss of a pregnancy, whether intentionally instigated or not, is considered in the medical terminology to be abortion.
You're exactly correct. I think in context of this conversation, I would say abortion is what I was saying. But in terms of medical terminology, it gets so confusing for women because, for instance, somebody has a miscarriage and then they look at their paperwork and it says spontaneous abortion. And oftentimes they'll come to me, they're like, I don't know why they put that I had an abortion on my paperwork. I would never have an abortion. And then I have to explain to them, no, this is just the medical terminology for what they're saying. Spontaneous abortion simply means that you had a miscarriage. It doesn't mean that you chose to abort your pregnancy. Different scenario. Oftentimes there's a lot of misconceptions as well about, is an ectopic pregnancy, taking care of that, is that an abortion? What exactly is an abortion? So in terms of abortion, the only abortion that people who are taking the stance of pro-life really care about, and what we would say is an abortion, is the idea of intentionally ending the life of a living human being, which is preborn.
Okay. Thoughts on that?
I agree 100%. It can be confusing for patients and it can be confusing for the general public, right? When we have, for example, politicians that are discussing abortion and using that word, that terminology, sometimes we have to take a step back and remember, like, are we really just discussing the intentional ending of a pregnancy that could go forward without harm to the mother or could go forward and produce a live human being? Or are we discussing some of these other cases, for example, miscarriage or an ectopic or things like that? So it just really depends. And sometimes it's a gray area. I think the whole issue of abortion can be a gray area.
Okay. So what is your position on abortion? And also, what is your stance on if abortion is ever medically necessary? You go first.
So I am pro-choice. I do believe it is, for example, I'm a woman. It's my body. It's my right to choose whether or not I want to continue with the pregnancy. That being said, I think every case is different. I couldn't speak for you. I couldn't speak for you, in making that decision. And so whether or not abortion is actually ever medically necessary, yes, I do think absolutely there are cases where it is.
Okay. What about you?
So I come at abortion from an equal rights sort of perspective. I believe that every human being, no matter their location, no matter their size, no matter their ability, that every human being deserves to be protected, and that every human being is valuable, and that every human being was created in such a way that they have such purpose in this life, no matter how long their life is, whether it be just the duration of the pregnancy, or they're only going to live a day after, or they're going to live 100 years, or they're going to live 100 years with an issue that might be considered difficult for most of society. I believe that every single one of those human beings are worthwhile and worth defending, and especially those that cannot speak for themselves. So I truly believe that there is never an instance where abortion is necessary medically. I believe that there is a difference between ending a pregnancy earlier through delivery in those difficult situations, if you have to, versus actually going in and ending the life of this preborn human being that cannot speak for itself.
Okay. Do you also, or what do you think about what she said about preterm separation versus abortion? Do you think those are different?
Absolutely. I really like that you make that distinction, because we just tend to like blanket everything under the term abortion. But for example, somebody who has a pregnancy that's implanted outside of the uterus, that's going to threaten her life. So are we making that distinction here where we're choosing to terminate a life, or are we making a decision here where we're choosing to preserve a life of the mother?
Do you have something to respond to that?
Absolutely, yeah. And in that case, you know, a pregnancy has implanted outside of the uterus, that would be the definition of an ectopic pregnancy.
Right.
And everybody knows that, unfortunately, an ectopic pregnancy is not able to survive. And its being present and growing actually does put the mom's life at risk, and a significant risk. And so with the ectopic pregnancy, 100% agree that that pregnancy needs to be removed from the mom. And always, like, in speaking to that mom, like affirming the fact that, yeah, this is your child, and I am so sorry that you're in this position. And I truly believe that this child will not live on this planet at this moment, but I believe that you will meet again. I believe that there is a possibility of an eternal life with that child, and that this child is valuable, and you are already a mother to this child. It doesn't make you any less of a mother. It doesn't mean that you didn't have a child. This one counts. And you can name this child, and you can refer to this child, and you can talk to this child, and all of those things. And so that management of that ectopic pregnancy, I don't think there's anybody who's on the pro-life camp or is standing up and saying they're pro-life that would ever want to do anything other than remove the ectopic pregnancy, because the value of the mom's life is so important, and honoring that preborn life is also important. But it's, yeah, that's, I feel, a completely different topic.
So since you're already talking about ectopic pregnancy, is the removal of ectopic pregnancy an abortion?
I mean, that depends on how you're looking at it. So if you're looking at like strict medical terms, yes, that is a therapeutic. I mean, you have, well, not therapeutic necessarily. Yes and no, right? You have to end that pregnancy. That is technically, in the medical terminology, considered abortion. But do you look at it in the same way as like somebody got pregnant because they weren't being responsible, and just, 13 weeks go by and they decide, I don't want to continue with this pregnancy? I think it's just, like I said in the beginning, it's such a gray area. There's no black and white here.
Mm-hmm.
I think it's more about the intentionality of it, right? So if somebody is choosing to end the life of their child through abortion, that is very different from a mom who has an ectopic pregnancy and would have given anything not to have had an ectopic pregnancy. The physician who is removing that pregnancy, yes, that preborn child is not going to survive, but the intention is not to kill that preborn child. The intention is to save the mother's life versus in elective abortion, the intention is to kill that and to end that life.
Do you agree with that?
I agree with that.
Okay. And so under the law, is that considered abortion? Because I think people, like when Roe v. Wade was overturned and different states have, passed certain bills like the heartbeat bill and things like that, people are thinking women can no longer get treatment for ectopic pregnancy. What are your thoughts on that? And then I'll have your response.
Sure.
I don't think that's true. I think people tend to overreact to these things, right? And go to like the next level of, well, if they're saying this, what does that mean for ectopic pregnancy? What does that mean for management of, and we could even get into all the other instances of like, say the mother has cancer and needs life-saving treatment. It's kind of
we'll get into all that stuff.
Right. So, I mean, no, I do think people tend to overreact and take that to the next level, but that doesn't necessarily, they're separate issues, right? It's one thing if, do you believe this is your right to discontinue a pregnancy that could go on and be viable or not? And that's completely separate from this. So no, I do not think that, if the law says all abortion, I really, and I would hope, don't think it's also including instances like ectopic pregnancy.
Yeah, I would absolutely agree. There was so much misconception about this and a lot of people making very inflammatory statements during the time that, the Dobbs decision came into place, where they would say things like, oh, now this has happened. And so women are going to die of ectopics because you can't remove an ectopic pregnancy and they just want to kill women. And, you have a miscarriage and you're going to become septic because you can't have a D&E because that's the same as an abortion and abortions are illegal. And that has never been the case. There have always been laws in place that the difference is if you have an ectopic pregnancy, that is a known medical emergency that any physician can, even in Texas or any place where it's illegal to have an abortion, you can absolutely have a removal of an ectopic pregnancy. You can absolutely have a D&E procedure if you've had a miscarriage and you want to remove that pregnancy and you don't want to pass it naturally. You can take medications that will contract your uterus if you're having a miscarriage to help expel the baby's tissue, the fetal tissue. All of those things are possible, and it has nothing to do with those laws that have been put in place in these places to prevent elective abortions.
Okay. And the opposing side would say, well, here now you're explaining all these handfuls of situations that are abortions that are medically necessary, but your argument is that those are not abortions, even under the medical consensus?
Correct. Because although, a miscarriage is called a spontaneous abortion, there is a difference between an elective abortion versus a spontaneous abortion. And so in the pro-life community, we would not refer to any of that as abortion at all. That's not what we're fighting against.
And do you think that that's a consensus within the medical community as well?
I think so, yes. But then I kind of come into another question where, like, say, I've had several handfuls of patients when I was working in a health center before where sometimes they come in and the pregnancy, like they're having the bleeding and it's, we do an ultrasound and we can see it's clear that this pregnancy is not going to continue. It's not going to be viable, but there's still a heartbeat. So is that an abortion in your opinion, Monique?
No, that's a threatened. So that's different. So when somebody is on the verge of miscarrying and they're bleeding, so that is a threatened abortion. Like I have a lot of patients in my infertility practice. So we're trying to help them get pregnant. They conceive. I always send them for a very early ultrasound at about 6.5 weeks. Why? Because I want to make sure the baby's heart is beating. And I want to make sure that there's no subchorionic hemorrhage. A subchorionic hemorrhage is a small bleed that's happening between the sac that the baby's in and the sidewall of the uterus. If there is a subchorionic hemorrhage, there are interventions that we can take to try and reduce that bleeding and to stabilize the pregnancy, and we can monitor their progesterone levels to help sustain that pregnancy. And so a lot of these women are not seeing practitioners like me. So they have no idea that any of this is available for them. And so they're in an early trimester and now they're having bleeding. So they're not completely miscarrying. Their cervix hasn't opened up. They're not contracting enough to like push out the baby, but they're definitely having bleeding. So this is a threatened miscarriage where it's a possibility that this may lead to a miscarriage, but that baby is not dead yet. So there's still a lot of interventions that can happen to try and save that baby's life. And I've had patients who have had humongous subchorionic hemorrhages, and we just kept them on that supplementation and we kept monitoring their levels, and that baby is alive today. So praise God that it's a possibility. So just because someone has a threatened abortion doesn't mean that it's going to lead to an actual
or threatened miscarriage, you mean?
Threatened miscarriage.
Yeah.
It doesn't mean that it'll actually lead to an actual miscarriage or loss of life.
What do you think of that?
It's unfortunate because not very many providers like you exist, right? So I worked in a federally qualified health center where those resources just were not available to the majority of patients. So then you have somebody coming in and it's like the gestational sac is sitting right at the opening of the cervix. She's having a lot of bleeding. All signs are pointing to this is going to miscarry.
So what do you suggest? Are you saying there's like something else to do instead that would be an abortion?
Not necessarily. I mean, I just think in the case of the patients that I saw, oftentimes they were left with very few options. Like you can see what happens or you can go forward with, terminating the pregnancy.
There are certain things I can't live without, and these days, Superhuman is one of them. Superhuman offers a groundbreaking new type of audio called activations, which are kind of like a mix between a motivational podcast, cinematic music, affirmations, and guided visualizations. There's nothing else out there like it. All of the audios are science-backed, and these audios are designed to be listened to in everyday moments. Whether your goal is to earn more money, get healthier and fitter, feel happier, be a more present mother, or virtually anything else, these activations will be the best tool in your toolbox to help you get there. I find myself reaching for the Superhuman app throughout my day. Whether that's working out, cooking with the family, or winding down in the evening, they can be listened to anytime, anywhere, and they're helping me so much. What makes these audios so different to anything else, including meditation, is that they immediately shift your energy within just a couple minutes of listening, and you can listen while doing something else. It's not meditation, it's activation. If you don't know where to start, try the Align Yourself Energetically with Your Goals one, or even the walking activation called Become Your Magnetic Future Self. They are so good. This is the thing for people who don't like to meditate and want a more energizing approach. It's so easy to implement into your routine, and guys, they have a crazy deal right now and they rarely do discounts. On top of the 14-day free trial, get over 60% off your subscription for a limited time only at activations.com/Ellen. There's literally no risk. If you change your mind and forget to cancel after the trial, you're covered by their money back guarantee. And the offer is only available through their website, not the App Store. That's activations.com/Ellen for over 60% off. Expires soon. What would be the benefit to terminating the pregnancy if you wanted that pregnancy? Wouldn't you be like...
No benefit if you wanted the pregnancy, right? No benefit.
So, but what you're saying is people should have access to get the abortion. Let's say they didn't even want the pregnancy.
If they didn't want it, that should be their option. They're right. If they're bleeding and all signs are pointing towards this may not be able to continue anyway.
Okay.
Right?
So,
but also I would argue that all people should have access to a practitioner like Monique. So if you want to continue the pregnancy, to be able to have somebody, a provider who's going to give you the resources that you need. It's just unfortunate that that's not available to everybody.
Do you have thoughts on that? Like, why is that's not available?
Unfortunately, the medical system that most doctors are trained through, I mean, I was trained through the same system. There isn't a lot of education about root cause, about supplements, about dietary changes, about, things that lead to really great health. It's a lot of, here, let's cover up the symptom.
Take this pill.
Yeah, pretty much. And so I feel like medical advances have been absolutely amazing. I mean, it used to be that a baby could not survive outside of the womb earlier than 24 weeks for sure. But now there are 21 weekers who are surviving, and with a lot of help, obviously. But now, like, so much more is happening in the medical community, right? There's stem cell things happening. There's actual printing of organs that will one day, I'm sure, be placed into people so that they won't have rejection when they're having organ replacement. I mean, there's like an amazing amount of things that are happening. And unfortunately, it takes at least about 18 years from the time that something is discovered to when it's actually brought to the physicians. And then it's actually like taught to the people who can actually provide it. So there's a lot in the pipeline, and when you step a little bit outside, when you kind of open that door a little bit to look at root cause medicine and ways that you can address a lot of these problems, you'll find that there are a lot of solutions that are available for a lot of people. But unfortunately, the majority of physicians, whether it be because of malpractice concerns or just fear of stepping out alone, are unwilling to take any risks like that. And oftentimes they're not real risk. It's just like advising someone on diet. So,
Okay, so Lynn, is an embryo or a fetus a human being? If not, what is it? And if not, when does the product of a pregnancy become a human being?
See, that's where I have a hard time answering the question, because although I have a pro-choice stance, I can't say it's black and white. I can't say at X amount of weeks you shouldn't be allowed to have an abortion, or at X amount of weeks. I mean, there does come a point where it becomes very uncomfortable. Is this a viable pregnancy outside of the womb, even with help? Should that person be allowed to terminate the pregnancy at that point? That makes me uncomfortable. I'm not going to lie, even being pro-choice. Mm-hmm. But I mean, yes, in theory, this is a human being. But if it cannot be viable on its own outside of the womb, I have a difficult time answering that question, despite my views.
Okay.
So I think those are two different things. And number one, I just want to acknowledge you for your willingness to be so open and honest, right? Your willingness to say, as a pro-choice person, I have some uncomfortability with the idea of late-term abortion. And that's like totally natural, as a mom especially, right? Like, we've carried these babies, right, and we've felt them move inside of us. So thank you. But being a human being comes down to one thing and one thing alone. Who are your parents? If your mom is human being and your father is human being, then what is created by the mother and father is naturally human being. And it doesn't matter what size that individual is, or where that individual is located, or how far along in development. That is a human being from the moment that egg and sperm come together and they create a unique individual with unique DNA. That embryo is still a human being. And that embryo just needs time to develop. And every single one of us was an embryo at one point. So yeah, I believe that it's a human being.
Any thoughts on that?
Viabilities are different.
Yeah.
But like, is it a human being?
Well, yes. I mean, technically, yes. It's DNA. Yeah. It's created a human being. Yeah, but that
Cool.
doesn't change
I love it when we can agree.
No, absolutely. No, I agree.
Awesome.
And I mean, I'm sort of unique in my pro-choice views, that I'm not super inflammatory about it. Like, I think that every individual is unique and every case is unique. I don't think across the board it should be one way or another. I think, honestly, for me, the decision to terminate a pregnancy is between a woman and her provider and her family. And so not necessarily between a woman and the government. Right. And that's where I get uncomfortable about the government saying no. That being said, yes, I agree, on that level, that embryo, the moment sperm touches egg, yes, we develop a human being, but that doesn't necessarily dictate how I feel about whether or not someone should have a right to terminate or not go forward with an undesired pregnancy. Pregnancy takes a huge toll on a woman's body and on a woman's mind, and on her ability to live as well. So there's so much here that to unpack, to really, like, that's why I say it's not black and white.
Okay.
I think pregnancy does, in some cases, take a huge toll on a woman's body, but there's also so many benefits to pregnancy. During pregnancy, that baby is actually sending stem cells into the mother's blood that are helping to rejuvenate the mother. When the mother actually ends up breastfeeding that baby, if she chooses to do so, that reduces her risks of breast cancer because it changes the type of cells that are in her breast. Just being pregnant for many women actually improves their mood. It suppresses endometriosis. It helps them to just like feel more balanced. There are many men that say, oh my gosh, love, we are in such a better place in our marriage when you're pregnant, because that whole PMS and the hormonal like shifts and the like 10 days before your period, most women don't realize that they're progesterone deficient, but in the midst of pregnancy, their progesterone's like skyrocketing and they feel like a goddess.
Yeah.
They're so good.
I definitely
But
feel
the
that way.
opposite
Yeah.
can also be true.
Absolutely.
you know?
There are women
Definitely.
who suffer greatly. And most of those women are women that have like liver toxicity and they're just full of toxins. And that leads to like worsening hyperemesis and all sorts of things where they're in a really difficult place. And what I would say to those women is, how can we come around you? How can we support you? How can we have our community come in to take away all those tasks, like do your laundry, take care of your kids, you know, all of these things. And these are things that we have done in the pro-life community. Like I have friends and patients that came to us and they were like, I need an abortion. I cannot hold anything down. I feel weak. And we're like, okay, tomorrow we're getting IV fluids to your house. Somebody is coming. We have these 3 couples that are going to drop off different things for your dinners. They're all prepared. Just need to stick them in the oven. We've got these 3 couples who are going to come over and watch your kids. And like, the pro-life community is so loving, so caring. Even when they don't have 2 dimes to scratch together, they will give of themselves to make sure that that baby gets a chance to live and that that mom is supported. And it's not like, okay, I'm just going to support you until you deliver and then see ya, hasta, we're out. No, it's like, however long you need us, now you're a part of our family. Why don't you like come hang out with us and have dinner with us? So there are many people that are in our communities who have been supported in that way.
I would say that's really amazing if you can find that community, but that community is not always available to everyone everywhere. And so what about the mom who, she's a single mom, she's working a job, barely making ends meet as it is, has no idea how she's going to do this, no family around, no friends around. Like, how is she going to go forward with this pregnancy feeling sick, mood changes, everything that's going to happen, and then not to mention the grand responsibility of raising a child, hoping they turn out to be a good human being, giving them everything that they need, being present for them. I mean, I was fortunate with all my children where I felt like I was supported by my partner and supported by friends around me. And I still am like, oh, there's so much I could have done better, you know?
Oh my gosh, there's never a parent who doesn't think that there's
Like,
so much they could have
so
done better.
much I could have done better and wish I could go back and change things. But it's unfortunate because sometimes, you know, people just don't have access to that type of community, those type of resources. So what happens then?
So what I would say is not that there isn't access. It's more of an issue of women not knowing that the access is available, right? Because for every Planned Parenthood or abortion center, there are like 10 to 20 pro-life centers available. And each and every one of those pro-life centers has all of these things available within them. But when you talk to the average woman on the street, it's, okay, like, who do you know that can provide any sort of care or help or whatever? And they'll say Planned Parenthood, but these other centers are not known. They don't have that money behind them, which allows that brand to show up. They're not unified under one name. But I promise you, if you just like Google pro-life in any city of the world, there is at least, you know, two plus centers. And like, if the centers exist, then you know that they can get help. But I think people just don't know what's available. And even in a place where there isn't an official center, there are so many like church groups and just people who are pro-life in general that would absolutely help. So I think there's a lot of people that feel hopeless when they really don't have to feel hopeless. They're just not aware of what is available. And I know, like we all say, the government is not giving them everything that they need. I agree. But the community needs to come up underneath and also help to support these women.
So what happens when they get you through the pregnancy, get you through the birth, the immediate postpartum period? It is a grand responsibility to raise a human being.
It is. And I think that is a decision that the mother needs to make as to, it doesn't have to be a decision of, do I kill my child or do I let my child live? It could be, do I allow another family who desperately wants a child to have an open adoption with me so that that child will know me for the rest of its life? They'll know all of their genetic history. I will be present for all of their birthdays. I will become like a part of that family. I will always be the hero to that child because I am the one that allowed that child to live. But that couple who desperately wants a child will financially, emotionally, physically take care of all the needs of that child. And that to me is a far better solution than for a mother to feel like she is in a box like a caged animal and she has no choice because there's nobody around her who loves her enough to support her and to walk her through this very difficult and very scary situation. And that she's left in such a point, like I honestly don't believe that any mother truly wants to end the life of their child. If they're given other options where I will provide you with all of the money, I will provide you with the housing, I will make sure that you have a job that can sustain you, I will make sure that this man who is beating you is out of your life, I will make sure that, you know, your health concerns are taken care of and that you have support. I don't believe that any woman truly wants to end the life of their child. And I think it's our job as a society to walk with those women and provide them every other option so that they do not feel destitute and broken down and useless and that they can't make this decision for life.
Yeah, go ahead and reply, and then I'll move on to the next question.
Yes and no, but I feel like there are so many more factors, right? Say you have just somebody who's maybe upper middle class, married, already has a few kids, and maybe, I don't know, let's try to think of an example of a recent patient I had. Somebody who's maybe like in her 40s, discovers she's pregnant and, you know, got 2 kids in college already, another one graduating high school, and is thinking to herself, how am I going to start over? And what is society going to say or think of me if I give this child up for adoption? Or somebody who has severe mental health issues, right? And they give birth again, and she knows, like, going through the process of pregnancy, birth, even adoption, if she chooses not to keep the child, could really impair her mental health to a point where it could be dangerous for her.
Yeah. In my experience, especially in the case of a woman with severe mental health issues, the taking of her child's life is far more detrimental to her than adoption. Like the studies that have been done out there have shown when they do a comparison of women post-abortion versus women who have given up I wouldn't say even given up, but have agreed to an adoption. The women who agreed to an adoption always have a better outcome emotionally, mentally. The women who choose abortion, even in the case of like rape and incest, those women are already traumatized by that rape and incest, and then they're making a decision to end the life of their own child who is half of their DNA. And so they're left with a lot of further trauma because of the trauma that they are now inflicting on someone else who is weaker than them. And so I wouldn't agree that having a mental illness is a reason to have an abortion, to try and prevent, like, difficult situations happen in life. And I don't think having a difficult life is a reason to kill somebody. I think that some of the most amazing people in this world are people who have come from the most difficult situations and they have overcome. And I believe that every single human on this planet has the ability to radically transform their life, and that they have the ability to live an amazing, beautiful life. And that nobody can say, oh, you're a depressed person, and so you're going to be more traumatized by this, so you should definitely choose abortion. Or who knows? That person may start the mood meter and tomorrow be like, I don't have depression anymore. You just don't know. And I feel like you can't say that about someone.
Right. Not necessarily that, but also, just when it comes to, I guess the fundamental difference between the pro-life and the pro-choice point of view is that, for example, in your mind, intentionally ending a pregnancy is killing somebody. But in somebody else's mind, it may not be seen that way. It may be seen as, I'm just choosing not to go forward with the pregnancy. This child is not viable outside my womb anyway, right? Just throwing that out there. So everybody sees it a little bit differently.
So if you have a color and 5 people look at it, they might all describe it differently. But you have to kind of look at the root of it, right? Was this child living? And did you do something to stop that child from living? And that's where we have the issue. So if the child has already passed, like in a miscarriage, yeah, you can move that child out of your body. But if that child is living and there's a chance that that child could live, then yeah, intentionally ending the life of a preborn human being is a problem for me.
Okay, I'm going to move on to the next question. What are your thoughts on when a baby is given a birth defect diagnosis that is not fatal, or something like a Down syndrome diagnosis, and then they're offered an abortion for it?
Even from a pro-choice standpoint, it makes me uncomfortable because I think that there are other options. That being said, it's not my decision. If it's not my body, it's between the mother and her provider. What is going to be the best for her?
Do you think that that should be mentioned within options for a mother who wanted her pregnancy and then was given a diagnosis like this?
I think it should be mentioned, but not encouraged. I think you have the right to know what your options are.
But then should it not be mentioned in times when the child is given a healthy check, like everything's growing fine, and the mother wants the pregnancy?
Well, I guess underlying, we all sort of know we live in a country where in many places that is an option. So when a patient comes to me and is newly pregnant and she's happy about it, do I present the option of abortion? No.
Yeah. So I'm just trying to make the distinction that when there is brought to the attention that there is a birth defect that's not fatal or something like that, like Down syndrome, you think it should be mentioned as an option for someone who wanted their pregnancy?
That's difficult. Mentioned as an option, it depends.
Okay, go ahead and reply.
So in my view, babies with Down syndrome, I believe, are the greatest gift to this planet. I have never once met a child with Down syndrome or an adult with Down syndrome that wasn't so full of love. And it's the one person that when you go to Thanksgiving dinner and that grumpy person from your family is sitting there and nobody wants to talk to the grumpy person because they're going to get into something and be angry and get upset. The Down syndrome person is going to walk right up to them and give them the biggest hug, and they are just going to melt.
100% true.
That is who they are. And in my view, it makes me so sad because 90% of Down syndrome babies are aborted. And I think of all of the beautiful people that could exist in our world, and our world is, sometimes I look out and I'm like, where is the love? Like, where are these people? Why are they being so angry and so hurtful and so mean to one another? Like, I stand out in front of an abortion center every weekend and I offer resources to women going in, and I'm like, sweetheart, I love you. Is there anything I can do to help you? And there are people that show up opposite me and it's literally like, F you, you bleep, how dare you, you're not really a doctor, blah, 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 blah. And I'm like, guys, like, I love you guys too. Like, I know you were a baby at one point too, like there's no need for the anger and the upset, but the Down syndrome people are absolutely to be protected. And so personally, when I have patients that come in and they're pregnant, it's always a celebration. If they are in the midst of a really challenging situation and they're coming into my office crying, hey, Dr. Ruberu, I'm pregnant. I don't know what I'm going to do. I'm like, okay, what do we need? How can we make this good? Let's figure this out so that you can feel good about this pregnancy and you're supported, and let's move forward. If they come in and they have a prenatal diagnosis with Down syndrome, it's like, oh my gosh, you are so blessed. You are like one of the few people who has the child with the smile gene. Like, you get the added bonus of a Down syndrome baby. You are so lucky. Thank God for this. And every woman that I have met who has been diagnosed with a baby with this prenatal diagnosis, and they come to my office after the fact, and she said, I had this baby and the baby was diagnosed with Down syndrome. And I was like, wow, that's so amazing. She's like, that's exactly how I felt. And she said, you know what they said to me? They said, okay, you have until 24 weeks to abort this child. And she said, that made me feel horrible. And I had to automatically go on the defensive to protect my child from these people who were supposed to be my doctors, who were supposed to care about not just me, but also my child.
I mean, there's so many different ways to look at that, right? Like, as providers, we feel that it is what we owe our patients is to provide them with options, right? Like, these are your options. But that being said, there's also another side to that. I would agree with you. I think people with Down syndrome are amazing. My favorite cousin, I'll tell you kind of a sad but sweet story. My mother passed away when I was really young. I was 14, and she was there, my cousin, and she was the one that held me as I cried when everybody else was like, I don't know what to do with you. And I'll never forget that. Like, she's one of the most beautiful souls on this planet.
Truly.
And so, but that being said, like, do I think that having a diagnosis of some sort of genetic abnormality or being Down syndrome is medical necessity for an abortion? Absolutely not. I don't agree with that. I do not think that is. But it's like kind of where it's that tug of war of like, okay, we're trained to let our patients know they have options. But it's sort of like, you're damned if you do and you're damned if you don't, right? Because then I present these options and I'm a horrible person for saying you do have options.
Yeah, that's really challenging. I think it's much harder for you than it is for me, because it wouldn't be an option for me, so I would never say it. But for you, you're kind of like, you don't feel good about having to say it.
I'm a feminist. I don't feel good about it, but I also don't think the government has the right to say yes or no. So then it comes down to, it cannot be like, I cannot just say it should be this way or that way. It's let's look at every individual case.
Okay. PregZen offers innovative intimates of period panties with snaps on the sides and moisture-absorbing technology that supports you in the best way while on your cycle. They're also perfect for postpartum use when your mobility can be limited, for easy dressing and undressing after birth. PregZen snap-on, snap-off, and Velcro side closures make being on your cycle that much better. No more pulling your underwear down along your legs, simply snap on or off on the sides. PregZen would make the perfect gift to a friend about to give birth, and their maternity line has a built-in belly band for your comfort. The creator of PregZen, Felicia, who is a dear friend of mine, struggled to put on her underwear during her first pregnancy due to water retention and sciatica pain. So she created an underwear line that you can put on without needing to bend over. Thanks to her genius patented design, anyone who struggles to put their underwear on, including those with limited mobility, pregnancy, post-surgery, and wheelchair users, can now do it easily and independently with PregZen. PregZen panties are comfortable, beautiful, and flattering. Enjoy this ingenious panty line and support a growing small business owner by entering the code ELLEN20 for 20% off their shop. I want to ask you then, is abortion ever medically necessary? What are the rare but real hard circumstances where women are offered an abortion for medical reasons that might say that they're medically necessary too after that? Do you think it is ever medically necessary?
I think there are cases when yes. However, I've yet to see one, honestly, in my own practice. Now, I haven't been practicing that long, right? I was a midwife for 5 years. I was a labor and delivery nurse 5 years before that. Now I work more in the psychiatric mental health realm of things. But
10 years is a long time. Like,
yeah, that is a long time.
Yeah. But I did, in the last year I was working with the Federally Qualified Health Center, we had a patient come in, and I didn't see her. It was one of my colleagues who they discovered that this pregnancy had implanted into her C-section scar. And the physicians in the practice were very heavily counseling her towards terminating the pregnancy because it could be life-threatening. This patient refused. She did go forward and give birth to a healthy child. So that sort of swayed me a little bit. Like, okay, are there really times? Are there really, really times when this needs to happen? But I think if I put myself in her shoes and I was heavily counseled by my physicians, like, you're risking your life by continuing with this pregnancy, would I have been brave enough to continue with the pregnancy? Probably not.
That's where I see like the influence of the provider is so important. And we're so blessed to live in a culture where not only do we have OBGYNs, but we have a subsect of OBGYNs, which are maternal fetal medicine doctors. Maternal fetal medicine doctors are trained specifically to deal with high-risk pregnancies. And so anybody that has diabetes, anybody that has liver dysfunction, seizures, whatever, automatically thyroid dysfunction, they get shifted over so that they're also being consulted on by these high-risk doctors. So the high-risk doctor's job is to follow that mother and that preborn human being's life and take it as far as is medically possible without causing any harm to the mom or to the baby. And then prescribing delivery at the correct time so that, if they can get you all the way to 39 weeks, yay, amazing. But if they can't get you all the way to 39 weeks, can they get you to 24 and give the baby some steroids? If they can't get you to 24, how far can they get you where it's still safe for you? And there are times where you can't even make it to viability. You can't make it to 21 weeks. And in that case, I would say, okay, you can still deliver that baby, and then that mom will have the opportunity to hold that child, to mourn that child, to bury that child, to give honor to that child, rather than that child being injected in the skull or in the heart with digoxin that causes it to have a fatal heart attack and go through all of that discomfort of that, or for that child to be dismembered, reaching in and grabbing the arm or the leg and taking off bit by bit the parts of the baby and then throwing all of that into the trash. Oftentimes, especially in those cases where it is more dangerous for that mom, like somebody with a very difficult cardiac issue, and her ejection fraction, her ability of her heart to pump and to get the blood out throughout the body has decreased so much. So yes, that is a very good reason to discontinue the pregnancy and to deliver that baby. But if you're talking about doing a second or a third trimester abortion at that time, that's going to take 2 or 3 days because you've got to now ripen the cervix, dilate the cervix, and then do this procedure versus I could have you in the operating room and within 5 minutes, I could have that baby out and we could have that baby in your arms and we could sew up your belly and, we can stabilize a mom in that situation. But I do not agree with dismembering or intentionally killing that child. That child may not survive. And miraculously, that child may survive. We never know. But it's the intentional ending of that life, which I have an issue with.
What do you think about that?
Well, what about the psychological effect on the mother? If she's presented this up, we know that this pregnancy may not make it to viability. We may get you to 19 weeks. And then it, becomes apparent that your life is at risk if you don't then end the pregnancy. So how about her having to make the decision between, I can stop this from happening now, or I know that I could get to 19, 20, maybe 21 weeks. My baby still may not survive. And now I've gone through this pregnancy and this attachment to this child that just this, the psychological, the mental health effects on her of having to experience that versus maybe her way of grieving is not going through the pain of continuing something that's not going to make it.
My attachment to my children, and I may just be weird, started with the minute I saw that positive pregnancy test.
Yeah.
And so I don't think that ending the life of a child later on, like I don't feel like I love my daughter.
And I'm not saying that mother would love the child less by ending it sooner.
So, but I don't feel like it would lessen the trauma of losing her child, whether she lost it at 19 weeks and the baby passed on its own, or if she ended its life. You know, the thing that she would have in her heart would be that she would know that every second of that child's life, all that child knew was love. And that every second of that child's life, this mother was fighting for that child. And on the flip side, if the mother caved and said, no, you know, I can't deal with the trauma, I'm done fighting, go ahead and abort my child. I have had so many women come to me, oh my gosh, in their 60s that had abortions in their teens, that have recurrent nightmares, that have like the sound of a dentist's office drill takes them back, and then they feel horrible because it's similar to the sound of the suction machine. Like the number of women who have been traumatized through the procedure itself, like I think she could escape all of that trauma, and she would also have that sense that like, I never gave up on my child. I gave my child everything that I possibly could, and its time was definite, but every moment of its life was so worthwhile. There's a beautiful example of this couple in Pennsylvania. Their child had anencephaly. Half of its skull was gone. And they were told straight off the bat, you should definitely abort this child. And they refused. And instead, they knew that they had a limited time. They made a bucket list of all the things that they would have loved to have done with their child if their child like was delivered and they were able to live out. So in utero, they did all of those things, and they took pictures and they made a memory book, and then they publicized it so that other people around could see how a baby could be honored in that situation. It was the most beautiful thing that I've ever seen. Like pictures of them at the beach, pictures of them picking apples, the stories, the birthdays that they celebrated.
Okay, let's give her a chance to reply.
But just not everybody can do that, right? Like I think that's absolutely beautiful, but not everybody is in the right frame of mind to be able to handle the emotional toll that could take, knowing that this baby isn't going to survive. Everybody processes and grieves in their own way, right? And maybe for one person, that is a beautiful way to grieve, knowing they're going to lose their child. For another person, that's more painful.
But I don't think having an abortion ends the grieving. I think it
just changes it.
Yeah, I think it's a continued grieving, because now it's not that not only did your child die, because your child dies in both situations, right? Not only did your child die, but now it was you who made the decision of your child dying. You actually paid somebody money to end the life of your child. And I think that is a far greater thing for someone to get over.
Okay, so yeah, you guys disagree on this particular part. Let's get into some of the specific diagnoses that happen and if abortion is ever medically necessary in those situations. So let's take, for instance, when there's an extreme and fatal birth defect, like when the fetus's organs are developing outside of the body. Can we discuss that one? You want to go first?
So what I would say in some cases is that that does not necessarily mean this child cannot go on to live a healthy life, right? Because we have a lot of amazing technology. So even if the organs are outside the body, a lot of surgeries, a lot of time in the neonatal ICU, but this baby could survive. It's interesting because although I do come from a pro-choice standpoint of I believe it's our right to choose whether or not to continue with a pregnancy, I also, if you were to ask me personally, what would you do in that situation? I would choose to continue the pregnancy I would not end it. So that's why I say I have like the feminist side in me that's very much like the woman and her provider need to have the discussion about what the best approach is, right? But it also, I can't answer for everyone. It always goes back to the same thing that I've said since the beginning. You guys are going to think she's so repetitive. It's not black and white.
Right. And does every hospital across the nation have access to these specialized
No. That's the thing.
experts like you were both
there's different
mentioning?
levels of
Yeah.
hospitals in every city and every community. But when a situation comes up like that, that pregnancy is often transferred to a higher level hospital. So it might be a longer distance, it might be more inconvenient, for that person, but
And more expensive.
Yeah.
That's the other side of it. Not everybody has good insurance. They're paying for these things too. So that's unfortunate too. We don't want that to make your decision for you. But I think in many people's cases that is what a lot of decisions come down to.
Why don't you go ahead and reply about that particular one?
So when it comes to preborn babies that have like their bowels that are outside, that is something where you can absolutely have surgery. They have spina bifida surgery. There's all sorts of in utero surgeries that can take place, heart surgeries. So it's really amazing where the technology has gone and the ability of these surgeons to do, especially here in the Philadelphia, New York area. There's so much that can be done, and all over the world, honestly. So I would never say that that's a reason to have an abortion.
Right.
I would never say
I would
there's
agree
any
with
reason.
Monique. That's
So-
not a reason.
All right. So what about like for like a medical reason for a wanted pregnancy? You're saying you agree. Right. Okay. So what about examples like pulmonary hypertension, severe preeclampsia, severe kidney disease, or cancer? Why don't you reply first?
So those are the things that I was saying. We would absolutely monitor that pregnancy for as long as possible, trying to make sure that the mom is well cared for and the preborn human being is also cared for. That fetus is given the opportunity to grow as much as possible and is supported as much as possible. And you watch it. It's literally a day by day, hour by hour sort of situation, providing that mother with all of the clues, all of the things they need to watch for, and you're following with them very, very closely. And I would never say that abortion is something that needs to be offered to them.
But it's also not really
Premature
referred to as
delivery.
abortion at that point, right? And take the case of somebody with severe preeclampsia onset prior to 24 weeks. What's the cure for preeclampsia? Delivery, right?
Yeah, but there's a difference between doing like a stat C-section and delivering versus someone being told you need to have an abortion
Right.
and then going in and dismembering a baby.
Would you agree?
I agree.
Yeah.
But that doesn't necessarily mean they have to have a stat C-section either. They could have
If they could have a
dilation
vaginal
and-
delivery,
right.
100%. That would be my
Exactly.
number one choice, definitely.
Mm-hmm. Yeah. Anything to add to that?
I just don't really see that as abortion. That's where the difference is, right? Like this is a pregnancy, usually like, for example, something like preeclampsia. If they've gotten this far in the pregnancy, chances are they want to continue, not always, but chances are they would like to continue the pregnancy. They want this baby. And so in my mind, that's not abortion. That's we have to deliver you early or that's a threat to your life.
Mm-hmm.
But there are definitely cases that I've seen where like somebody has severe preeclampsia. She's, I had a patient, she had HELP syndrome, which is like severe preeclampsia. And she was, I think right around 24 weeks. So it was like right on that edge where at that time when I was in that program, the neonatologists were very strict. They were like, if it is 23 weeks and 6 days, we are not resuscitating. If it is 24 weeks and 1 day, we will offer you resuscitation, which is kind of crazy considering now we know of 21 weekers who have survived, right?
Why did they do that?
It was just a personal call that those particular people made, or at that time, the medical system believed that that's what was appropriate. So that's what they were told by the association that's what they should do.
Or what technology could provide at that time.
Yeah. So, but
Technologies
now
are-
there's
are-
been more advances. So
So are you arguing for that there's no reason to at maybe any point to say that?
I would say there's no reason ever to have an abortion. So,
well, I mean,
in
to
what
say
situation?
that we will not resuscitate.
I would never say that. Like, I would say you give that preborn baby and now delivered baby every chance, and you try and help it as much as you possibly can. I would never say don't resuscitate. I would never say take the baby and put it in the corner and see what happens.
Like that was born alive.
Correct.
Do you agree with that?
I would agree.
Yeah. Okay, interesting. What about the diagnosis of trisomy 18?
That's a tricky one because that's one traditionally thought not compatible with life, right? Trisomy 18, trisomy 13. So I was actually, when I was a nursing student, I was in a delivery of a patient who she was maybe in her late 30s or early 40s. I can't remember, but the baby was a surprise. The fetal sex was a surprise. They never had an ultrasound throughout the whole pregnancy. They didn't do, and they refused all genetic testing. So when the baby was born and it was quickly realized that this baby had trisomy 18, it was very difficult to watch the family go through the pain of realizing what was happening and that despite best resuscitative efforts, this baby was not going to survive. That was really, really awful to watch, the pain that I watched them suffer. Now, do I think it would have been better if they had known sooner and chosen not to progress with the pregnancy? Not necessarily, but I can say that was really, really difficult and seemed to be very painful for them and painful to be a part of. So does having trisomy 18, a baby with trisomy 18, mean that abortion is medically necessary? No.
Okay. Can you go ahead?
So my view on trisomy 18, absolutely. There are so many babies with trisomy 18. It's kind of a spectrum. So you have some babies that won't survive at all. In utero, they'll pass away. And you have some that will survive to the point of delivery, and you'll have some that will survive far past that. So I think of Senator Santorum's daughter, who is, gosh, she's been alive for many years now. I think she's around 10. I might be wrong with her age, but she's not a toddler. She's a grown child. And the thing that, when I read the book that her siblings had written about her and how they said that she was the greatest gift that they had ever received in their life because she helped them to understand the worth of every single day. Because not a single day with her were they promised. Every day was a gift. And she could not participate in things the same way that they did. She had a lot of medical issues. They had to go to the hospital many times. There were times that they thought she was near death and then her life was saved. And it was absolutely moments of trauma in the midst of moments of joy. But that proved to me that just the value of that life and their willingness to allow her to live out her life despite her diagnosis, I just found that to be such a beautiful and honoring thing. So.
It is beautiful. So what would happen for a family, for example, that doesn't have the financial resources that they have or isn't able to take care of this child? And are they able to offer this child for adoption? Are there families willing to take this on?
Actually, I personally know families that have adopted. I have one family friend. They have adopted a boy who is completely blind. He has severe autism. And then the mother of that family is actually blind. They have several other children who are seeing. And there are several families that I know like that who have made the decision that they are personally unable to have children or they're not having children, but they are opening their doors to children who have medical difficulties. Like they seek out those children.
That's beautiful.
Yeah,
we need more people like that in the world.
Absolutely. We do need more people like that in the world, but those people do exist. 100%.
So earlier when we started this aspect about if abortion's ever medically necessary, you said yes, though you haven't seen it in 10 years and you've been practicing.
Personally have not seen it. But then I think about the mom who, for example, has a cancer diagnosis and has to undergo like major, radiation therapy. And
so we wouldn't see that as an abortion, right? In the pro-life movement, if a mom has a cancer diagnosis and she opts to have chemotherapy, we know that that child is likely going to pass in the process. But that is not a reason to dismember the child or to inject the child with digoxin. Instead, in the midst of the chemotherapy, that baby will likely pass. And that's different.
Well, if she's first trimester, we're not injecting or dismembering anybody. We're just
That baby will pass, she will miscarry.
Right.
Oh, but you're saying have an actual, you're saying the abortion, it wouldn't be dismemberment is what you're arguing. She's saying an abortion even.
Right.
So say, for example,
but suction abortion in the first trimester is still dismembering the baby.
If they're doing suction abortion, I'm talking about, say, okay, she's 8 weeks along.
Right.
She has this diagnosis. She's got to go forward with her treatment.
Yeah.
Are you saying that taking the misoprostol, mifepristone is going to,
So that's the medical pill abortion, which is still an abortion. You're cutting off the progesterone for that baby.
But this isn't dismembering or, it sounds really horrible how you say it. So
but that's what it is, right? I mean,
if you're doing a suction abortion, absolutely.
Yeah, that's what it is. But the abortion pill, abortion with RU486, I'm so glad you brought this up, is absolutely an abortion because with the abortion pill, you're cutting off the progesterone to the baby, so the baby dies. And then you're using the misoprostol to contract the uterus and expel the baby, right? So that is not the same as a mom who is in the midst of chemotherapy, and the chemotherapy is it's not the mother's intention to kill the child. It's a secondary effect from the chemotherapy that we're using to try and save the mother's life.
So do you feel that that's any better than ending the pregnancy earlier for her to undergo chemotherapy? You would rather, continue the pregnancy, subject this unborn child to the chemotherapy as well until they die?
Correct, because it's not the intention to kill the child. It's the intention to kill the mother. You're not directly trying to kill the child. Yeah, sorry. Oh my gosh. Yes, it's the intention to heal the mother. You're not intentionally trying to kill the child. So that's different.
But there's something to be said about that child is now being subjected to the chemotherapy. We don't know what they feel.
The trauma from the abortion is, I think...
You think that's worse than months and months being subjected to?
I don't think that, I think with that first chemotherapy treatment that if the child is early enough in the pregnancy that would likely end the life of the child.
Are there ever any times when an abortion is kinder than not getting an abortion? I remember seeing some media story of babies in the womb who were more developed and at that point had could feel pain, and I guess there was some kind of diagnosis where they were feeling pain. So what are your thoughts on that? And they were having some kind of medical diagnosis.
So when you're doing an ultrasound for a baby and you touch on this side of the uterus, even at 10 weeks, right? 10 weeks, you're just seeing little arms and legs, and you press over here, that baby runs to the opposite side. So we say in the medical community that, there is a certain point in gestation where the brain waves are happening, where the baby can feel pain, all of those things. But I don't know that we definitely know exactly at what point, could it possibly be even prior to that they feel pain? So no, I don't think that the abortion procedure is a brutal procedure. It's barbaric. And I don't think that it could ever be considered kind or gentle.
What about you?
I don't know, because like you said, we don't know at the exact time that this baby can feel the pain or feel, how things change. But in my mind, I think if I'm going to undergo chemotherapy, I would want my child to suffer less. So what's going to be suffering less? Ending the pregnancy early or going forward and seeing how far they can make it?
Do babies ever survive after chemotherapy?
I have not heard of specific cases. I haven't encountered anybody that has had chemotherapy in.
Anima Mooney Herbals. If you haven't tried anything from their apothecary shop, what are you even doing? I'm serious. They are an incredible apothecary with protein powders, herbal remedies, and beauty kits that are the perfect addition to your healthy daily habits. I'm currently obsessed with their Master Longevity Elixir Kit, and I'm gonna need to give this kit to someone I love soon because it really is enhancing my life. Each bottle covers an essential aspect to everyday life, such as immunity, beauty, aging, sleep, joy, and longevity. The kit includes elixirs like black elderberry, Fertility, Cure-M, Collagen Booster, Dream, Soma, and more. Anima Mundi Herbals was founded by herbalist Adriana Ayala, and her apothecary uses over 200 different sustainably grown herbs from around the world to create intentional products that contain zero fillers, binders, or flow agents. They also use eco-friendly packaging in recyclable glass or biodegradable bags. So I got you a discount code for you guys. Enter EllenFisher20 for 20% off. Click the link in my show notes below. So when you said, going back to my question earlier, when you haven't seen it, but do you know of a specific diagnosis or times when it is medically necessary? Because your original stance is that, yes, it is sometimes medically necessary. So when is it medically necessary to have
So
an
I
abortion?
can never say yes exactly. Like first of all, I'm a midwife, not a surgeon.
Yeah.
and definitely not maternal fetal medicine, although I have worked with some amazing maternal fetal medicine physicians, but I'm not one.
Mm-hmm.
So I think my education knowledge base is just slightly different. Midwives kind of come at it from a different, more of a holistic sort of different way than like the traditional medical model.
Mm-hmm.
So let me just preface my answer with that.
Yeah.
So whether or not there's an exact instance that it's absolutely medically necessary, I would say only if there's a true threat to the mother's life. If progressing with the pregnancy is going to mean threatening her life, mother's life.
Okay.
And I'm not saying that the mother's life is more important than the baby's life. That's not what I'm saying. But she has the choice. It's her body. Am I going to continue with this pregnancy knowing that I could die? Or am I not going to?
So I guess, your arguments always kind of come back to this, my body, my choice kind of,
They do.
right? So my only issue with that is that although your body is housing the baby, that's a completely different, distinct body separate from yours, which is within your body. And I feel that because that is a human being, and I believe that all human beings deserve human rights, that body within your body, that human being deserves the right to be protected, and that human being deserves to be fought for, deserves to have somebody stand up and speak up for that life.
And I see your point of view on that. But what if it means you have to choose between this baby, this growing unborn child, this life, or this mother who has other children to take care of and a spouse and family members, and you have to pick. We're not going to continue this pregnancy for whatever reason so that the mother can live, or we're going to continue this pregnancy at the risk of mother not continuing her life. The rest of the kids now have no mom, including this unborn child. Or what are your thoughts on that?
And that's exactly why I said the maternal fetal medicine doctors following along closely and making sure that it's as safe as possible for as long as possible to give both the best possible
But when it
chance.
gets to the point where you have to make that decision.
Yeah. So I'm okay with delivering the baby early, which may not survive, and allowing the family to mourn that child versus saying, okay, no, that's going to be too painful down the road. So let's just go ahead and end this now. And let's go ahead and have a dismemberment abortion, or, inject this baby, or do a abortion pill and directly try and kill the child.
It's a fair point.
Yep. Okay. So this is something important to distinguish under the law. Do you know if any current laws banning abortion explain distinctions like these?
So absolutely. In Texas, there is the law which has stated that abortion is illegal, but there are exceptions for the mother's life. There are exceptions for, all of these different scenarios. So delivering early is absolutely a possibility for those women. But if it's not, a life and death situation, like the Kate Cox issue in Texas was not that her life was at risk at that moment. She had a trisomy 18 pregnancy, and I don't know like every in and out because I'm not her physician. I'm not privy to her notes and everything else. But from what I have read, in that situation, she was given a diagnosis of a trisomy 18 baby. She had a history of 2 prior C-sections. So now this would necessitate a 3rd C-section for her. And she made the decision to protect her future fertility because she felt like she could maybe only have 3 C-sections. And that if she wasted the C-section on this particular baby, then she may not be able to have another one. And that would impact her fertility. That being said, I come from a hospital where I have known women who have had multiple C-sections. It all depends on the quality of the surgeon and how they put you back together and how well you heal. And so, not that I'm an advocate for multiple C-sections or anything like that, but I don't believe that she medically had to have an abortion for that baby. She was not, to my knowledge, at the point where, her life was at risk. She had any sort of edema in her lungs. They had excessive amounts of fluid around the baby that was making it difficult for her to breathe. I don't think that any of those things were happening at that time. So, yeah.
Do you have anything to say to that?
I mean, that's not, I agree. That's not a case where the medical necessity piece actually comes into play.
So for both of you, what measures can be implemented within healthcare systems to ensure that women receive comprehensive prenatal care and support, thereby reducing the likelihood of encountering situations where abortion could be considered by some medically necessary?
I think medical care, I'm all for the best medical care available for every single woman. I absolutely love women and I want them to be fully supported. I want them to have not only like traditional allopathic medical care, but I would love for every woman to understand what's going on in her body and to be able to support her natural cycles, to understand when she's fertile, all of those things, and not to be covering up symptoms. And I think that it's just so much education is needed.
From the start.
From the start.
Starting even in schools when they give you sex ed, right?
Exactly.
We're just taught use birth control, protect yourself, but we're not actually taught about our cycles. Sometimes women nowadays, or young women, they get their period and nobody's ever talked to them about it. They don't know what's happening in their body. They don't understand how it works.
Absolutely. So having a basic understanding of what does it mean to ovulate? What does it mean when I'm fertile? What is actually normal? What is not normal? All of those things are basic things that I'm working really hard in my practice, and I'm creating an app as well so that women will understand, is my cycle normal or is it not normal? And that from that basic standpoint, if they can have an understanding of what's normal and not normal, then maybe they can get help for all of these other issues that might lead to other problems, hormonally, PMS, mental instability having to do with their hormones, abnormal bleeding, all of that sort of stuff. So I think there's just so much more education that needs to happen. The way that we educate physicians and, nurse practitioners and PAs. I have a lot of people coming through my office. There are a lot of physicians who practice similarly to me. They are also educating people in those ways, but it's challenging.
It's a whole societal shift. We need to change how we're educating people from the start, right? At the physician, nurse practitioner level, but also individuals. And then ultimately it falls on each woman as an individual to see what resources are available to her, to get out there and what apps are helping me track my fertility and what can I do to prevent pregnancy? Because here's what it comes down to. Sometimes pregnancy is unwanted, yes. But it's also really important to, if you're sure you don't want to become pregnant, try to take the steps to prevent it in the first place too, right? That's also really important. So we have to, but the problem is a lot of times the education is just not there. The resources aren't there. We don't know, or some people don't know what's available to them to make these decisions.
Okay. Yeah. Next question I have for you both is a child in utero entitled to human rights? And if not, at what point are they entitled to human rights?
You first.
I've stated this all the way through the podcast. Yeah. So I think my stance is pretty clear.
Yeah.
Yes.
And I've said the same thing since the beginning. It's gray. There's no yes or no. But
under the law, there has to be some line, right?
I just don't think that the government is the right authority to decide.
So even at 39 weeks pregnant.
Well, okay, that's different. See, that's
so
why I say it's not black and white. It is not black and white.
Well, there has to be a line, right? At some point, either some people will say at birth, right?
Yeah.
But it sounds like maybe you don't agree with that.
Viability would be my answer, but that's an opinion. I fully admit to that being an opinion.
Yeah.
So
an opinion that you're not confident to say that it could be like a law, that you're okay with that being a law.
I don't like the idea of it being a law.
Is there any point within the pregnancy where you are okay with it being a law to where the child in the womb has human rights protection?
I think if that child is viable outside the womb, it should have some level of protection. Yes.
Okay. Anything to respond to that?
That's awesome. I'm so happy to hear that you believe that there's some point in that preborn life that child deserves to be protected. And I would say the age of the child, like, I would just encourage you, like, your children that are now alive outside of the womb were the same people at 24 and 1 weeks that they were at 23 and 3 weeks. And their value didn't change. The amount of love you had for them didn't change. And so I would say just consider whether or not that might be able to shift backwards somewhere.
Well, that's where it just comes down to, like, the feminist view, we can't just blanket statement. We can't blanket make a law that applies to everyone, because that puts people in dangerous situations where, like, we go back to the 1950s where women are like trying to use coat hangers to terminate their pregnancies. That's dangerous. But at the same time, when you said that the moment you saw the plus sign on the pregnancy test, you loved your children, I 100% relate to that. 100%. I wanted all of my children. I wanted them more than anything, and loved them from the moment before they were even conceived.
Yeah. And
right?
I totally get that moment of seeing a pregnancy test can be the most devastating and scary moment for a woman as well.
Yeah.
But I feel like in that situation, why is it scary? Like, what is going on in her life, and how can other people come around her to support her so that it doesn't have to be as scary? So that she can protect the life that's within her, because I feel like most women would want to do that if they were capable of that.
The reality is that's just not available to everybody. Not everybody has that community willing to rally.
It's not available. I feel like they just don't know.
Okay, so pretty much last question I want to get to is, could abortion bans prevent women from getting the care that they need?
No, I don't believe so. Because abortion bans, it's really interesting. There are so many women that I encounter in my pro-life work. I go and speak all over the place. And I have met time and time again women who chose abortion, and their words out of their mouth were, if it was illegal, I would not have done it because I'm a law follower. And so there's a whole segment of the population that now regrets the choice that they made, that they would not have done this abortion if it was considered illegal. And all of these laws that are in place have exceptions available as well. So if the mother is, at the point where the mother will not survive, they always say, you can deliver that child, you can end the life. But I don't think having a law in place is causing women to have these coat hanger abortions. There will always be somebody who does something like that. But Bernard Nathanson himself, who was the person who was an abortionist, and he's the one who made all these statements about all these illegal back alley abortions. When he changed and became pro-life, he admitted publicly that he made that number up. It's in his book. And so that fact that keeps getting pulled out over and over, the back alley abortions, they're all going to happen. It's going to be horrible. Like, yes, there are some women who will do that. Absolutely. You're not going to be able to stop every single woman, because we don't have control over every person and their actions. But the level of that he was talking about while he was pro-abortion, he admitted later that that's not true.
Want to respond to that?
I just find that very interesting. I haven't.
Yeah, look it up. It's like it's the craziest conversion story you'll ever read. But that man he was the force for abortion. He promoted abortion more than anyone in that time when abortion first became legal. And then he had a radical after ultrasound when he was able to see the baby and what he was doing.
And do you think that abortion bans could prevent women from getting the care that they need?
I think it complicates things. I don't know that it would necessarily prevent, but I do see a lot of people freaking out about it, right? And I freak out a little bit about it, like how and I know that sometimes we go into this place of like worst case scenario, doomsday, like we're going to be Handmaid's Tale society. I don't really think I think that's just, like fear-based, fear-mongering, honestly. But at the end of the day, there's just you can't just say yes or no. Like you really have to look at just as you as a provider, you look at every individual person in front of you, you look at their symptoms, their background, their root causes, you look at everything and you make a plan for that person individually, not based on what the law says necessarily or what the government says is okay or what you personally think is okay. You're looking at the whole picture, the whole person. And so that's all I'm saying. I think that we have to look at each individual as an individual.
Okay. Do you have any closing statements or anything that surprised you that you guys actually agree on?
No, I was just so happy to hear that you're not like 100% for abortion at every instance, like at every point, no matter what the situation. That's very refreshing.
No, I am definitely not pro-abortion, but I am pro-choice. So there's a very, very distinct difference there.
I'm pro-choice. We all make choices every single day of our life, but that's the choice to end the life of a living child, which is
depending on
I
the
think,
circumstances.
But I just really want to acknowledge you for your willingness to like show up and to be here and to be so open and candid. And it was just such a joy to have this conversation with you. And thank you so much.
No, thank you. It's been an absolute pleasure to get to know you as well and to learn more about the work you do. And I can see that you're a very caring provider that does look at everything, right? Root causes. Like that's the discussion we had before the podcast even started, looking at root cause medicine. And I immediately was drawn in and want to learn from you. And so thank you for letting me be a part of this as well.
Yeah. Thank you both for being here and educating us on what you know about this topic. It's very fascinating and an important topic for sure. All right. We're going to end it here. Okay. Thanks. Bye.